Okay, start.
Hello.
Hello.
This is Dr. Gabra, the doctor in the rheumatology clinic. Are you Mrs. Selena, 35-year-old?
Yes, doctor.
Well, I understand that you have a disease called systemic lupus erythematosus.
Yes, doctor.
Uh,
I have this disease and I am taking a medication called mycophenolate for a long time. Now I am here to discuss about the issue that I want to take a baby. And I want to discuss my condition during my pregnancy if there is any problem with that. So, can you tell me? Can you discuss
okay.
that with me?
I appreciate your concern, Mrs. Selena. As you said, the mofentil drug is may affect your planning of pregnancy. For that, you cannot plan for baby until I will refer you to the joint doctor and woman doctor, and they will discuss with you the plan, and maybe they will change your medication.
Okay, doctor. So I just want to know that will my condition be worse or improve, or can I take a baby at now?
I appreciate your concern, Mrs. Selena. Don't worry. You can take baby, but it should be with a strict observation and control and follow up by your joint doctor and woman doctor. He will stop your medication of mofentil and he will replace it by other medication, and you will be under close follow up.
Okay, doctor. And
Is that okay?
is there any chance of affecting my baby in any way by my condition?
Actually, Mrs. Selena, I appreciate your concern. The disease you have, it affects many system and many organ in your body. And when you start to have a baby, uh, your baby increase the load in the body, and maybe you'll have retain of water in your body. Maybe your blood pressure will be increased and you will need more monitoring. Maybe somehow your water work, it will be affected, and you will need more follow up. Your skin rash as well can be affected, and you will need monitoring.
Okay.
Is
So that
that
you are
okay?
taking that my baby will not be affected by my condition.
Uh, actually, unfortunately, there is a chance that your baby will carry some element of your blood that in some cases, rare cases, he will carry this element, and it will affect him, especially his heart.
Okay. Is there
For,
anything that you
for,
can do?
for sure, you need close follow up by your woman doctor and joint doctor, and he will discover this condition early, and he will decide further regarding.
Okay, doctor. So it is our actually I have lost two babies before, so I am totally afraid. So can you suggest me anything that I
Uh,
could start now so that I can have a healthy baby?
I am so sorry to hear about that. For sure, I will refer you to the joint doctor and woman doctor. They will prescribe for you medication that it cause thinning in your blood
Wait
and
remaining.
reduce. It will causing thinning in your blood, and it will avoid this condition if it is caused by clotting, and they will monitor your condition closely, and if you need further management and assessment at any time, they will suggest directly. Any more concern you have?
Do I need to follow up any specific lifestyle this time?
For sure, you need to be in follow up with your doctor. Avoid sunlight, reduce water intake, monitor your blood pressure, and avoid long travel and gentle exercise.
Okay.
And I will provide you with some leaflet and brochure. You will have more information about your
Time up.
condition and how to plan for your pregnancy. Thank you very much, Mr.
Okay, thank you. So I am discussing this condition now. Okay, for first of all, I think you could have done better in this case. You were very fine on the previous case because patient is here to discuss about her pregnancy condition, and you are saying that she can be pregnant right now. But first we have to see her disease activity. Okay. First, we have to see her other organs involvement. We don't know that if she is totally under remission or not.
But I can ask her directly if her symptom, if there is any
Yes,
symptom right
you could have
now.
asked that. Do you have any symptoms like past? No. Okay. At this time, we will assess you now, and we will check up if you are ready for this. Will it be okay for
Mhm.
you? Okay, we are going to run that test for you. Okay. Do you have any problem with that? Do you have any problem with that? No, I have no problem with that. You can run the test. Okay. And
Very
in the meantime, you said that you are going to involve the gynae doctor. You are going to involve the joint doctor. That is fine. They are going to review my medication, and after that, if I need any medication, if I need a medication, I will be provided. I will be given that. And at the same time, I want
very
to
valid.
know that will it affect my? I asked you that strictly will my condition affect my baby? Okay, at that point, you didn't give me answer directly. So that again, I have asked you later that will
Mhm.
this condition affect my baby? If that in that case, you if you have told me straight that yes, there is a very little chance of affecting your baby, especially his heart, but we will monitor you, and we will also run the test if you have this type of problem with that, so that we can take a care in advance. Okay? That is, you are going to do antibody. Okay. And
Is
also
there anything else we need to monitor here?
there are lots of that disease activity, her total remote SLE profile should be done along with other extractable nuclear antibody, and also we should monitor her symptoms totally. And also another thing that she want to take baby, so that you could have asked it by your own that okay, may I know, or may I know a personal question? Okay, that do you have any baby, or it is your first baby? Okay, because you don't know what happened before, if I have taken any baby. And also I told you that I had lost two babies, and at that point you could have asked that was there any diagnosis, or why okay, I am sorry to know that. And may I know that was there any diagnosis at that time? And SLE may be present, SLE may have associated with antiphospholipid syndrome antibody. Okay, so that she may lost her baby previously.
Mhm.
So if you ask that, I have told you voluntarily that I have lost my two babies previously. So it is very important. So you should have also monitored that. There is something hidden here, because it seems straightforward that impact of disease on pregnancy. But and also there is something that will it affect my pregnancy? Okay, there is a rule of one third, that is one third patient will feel fine during the pregnancy, one third patient will be same as before pregnancy, one third patients will worse. And also there is a chance of getting worse after the end of pregnancy. So we need to closely monitor you during that time. And also for lifestyle, I asked you that do I need to follow any special lifestyle? Okay. So at that point, you could have asked about my smoking habit, alcohol habit.
Yes.
Otherwise, you have done everything. You have touched every point. You have at least you have answered all my question, and not in a geopathic manner. You have whatever you have told, it was straightforward. That was fine. Do you want to add anything?
Actually, I don't have any background knowledge about pregnancy and sleep.
Okay. If
So the effect
okay,
on the baby only the
okay,
heart blocked
okay.
due to the LO.
Okay. It is a issue that if you don't have any knowledge with that, okay. In that point, in that case, you always should mention that okay, I am not particularly aware of this condition, and I am writing it down. I will let you know after getting this information from my consultant.
Mm,
Okay, this is not your
mm,
fault
mm,
not knowing this, but hiding something or not telling something, that is the fault. You can
mm,
always,
mm,
and there are lots of cases where patients will ask a lot of questions that we do not know. At that point, it is straightforward. And even if you tell the right answer, or even if you mention that I do not know this, I will let you know after knowing it from my
After I
consultant.
confirm, yeah.
You will get the same matter.
Mm,
Okay, so whenever it comes with pregnancy, we have to ask a few questions that if she has any history of previous loss of sight and her symptoms at this time. And we also need to advise her that we will assess your symptoms and we will assess you that how is this condition is now. Then we will take opinion from the guy, from the female doctor, and they will be. And after getting the information, we will. In the meantime, we will review your medication from the bone joint doctor, and after that we will let you know that if you are fit for it not. And I am sorry that I cannot tell you exactly right now if you are ready for it or not.
is it correct that SLE got some remission during pregnancy?
Yes, pregnancy itself is a immunosuppressive condition. So most of the time on third patients feel better during pregnancy. Most of the patients, and some one third patient feel same during pregnancy, and one third patient may worsen during pregnancy. And after
Mm.
pregnancy, their condition get much worse, and that is the time uh, need to close monitoring.
And she will need Clexane, right? Clexane and prednisone steroid during the pregnancy. The
Hydroxychloroquine,
treatment will be steroid.
and steroid are given usually, but we are not going to mention that because we are not expertise in that area. Rather, rheumatologist and gynecologist will prescribe that. We are just assessing her, and we are making her. We are just giving her initial management. We are not giving her the consultant level management. It is not our
Mm,
duty. Okay, overall, this was fine. I am going for the next stage. Okay.
okay.
Okay. Start.
Hello.
Hello.
This is Dr. Gabra, the doctor in the dermatology outpatient department. Are you Mrs. Selina, 35-year-old?
Yes, doctor. Yeah.
So nice to meet you, Mrs. Selina. We are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So how are you feeling now?
Not so good, doctor. My condition of SLE is getting worse, and so your doctor ran needed a tissue test that was done on my back, and the test it was told that test reports would come soon. So I actually no want to know that, doctor, what is happening with me.
Ms. Selena, I'm sorry for your suffering, and I'm here today to explain to you your current condition. Mrs. Selena, I apologize for that, but something unusual happened to your tissue tests.
What do you mean by that, doctor? Is the report is very bad?
I'm sorry to tell you that, Mrs. Selena, but the sample mistakenly was lost.
What is lost, doctor? What are you saying? You have lost my tissue?
Please, Miss Selena, accept my apology in behalf of me and my team. But this mistake very rarely to
Doctor,
be
I
happen.
cannot appreciate this. I am suffering, and you know that my condition is so severe. And again, with that, how could you do it? Why weren't your team was so responsible? You can see that I am suffering a lot, and even it has become difficult for me to maintain my daily activities, doctor. And at this time, you are doing this. It is just a joke, doctor.
I'm so sorry, Mrs. Selena. I appreciate your feeling, and I know how difficult time you are experiencing. But believe me, this was totally unacceptable. But in the same time, it was unintentional, and this very rare to be happen. And for that, we will raise a report for the incident happen,
Doctor,
and
whatever you do will not bring my condition back, and I am even suffering back after taking the tissue. I have a lot of pain, but I have tolerated that. And again, you are telling that it is not. And also, your doctor said that without that report, they won't be able to treat me properly. So you are just
uh,
killing me.
please, Miss Selena, accept our apology, and we are really sorry. But we will, our hospital take this incident very seriously. We will raise a report to the directory department in the hospital, and they will do action to correct and to prevent this incident to be happen again.
Okay, doctor, whatever I do. Now, what do you suggest? What I should do now? I cannot do that
Uh,
biopsy again, doctor. That was so painful for me.
we will. Our team suggests that we will do another sample from your kidney, and we will take all the consideration not to have any pain, and to save the tissue sample. And I'm assuring you that mistake will not happen again, and the sample will result will help us
One minute
so
remaining.
much to guide our treatment in the future. Mrs. Selina, you have a very serious condition and need result of our sample to guide our treatment so you can get better and improve your condition.
Okay, doctor, I can
Are you
understand you. I can understand your concern, but will it take so much time and so much pain again? That is unbearable, doctor. I rarely felt this type of pain in my life.
Yeah, Mrs. Selena, I appreciate your concern. We are so sorry, and we will do the test as soon as possible, and we will make sure the best team will do your procedure and to have the result as soon as possible, so we can guide our future treatment to let you get better in the future.
Doctor, who lost my tissue, doctor? Was it a doctor? I just want to know, and I just want to meet him.
I appreciate your concern,
Time
Mrs.
up.
Selena. Thank you.
Thank you. Actually, this was a totally fine case. You have performed a very well case. Just one thing, in the at first case, you said nice to meet you. Was it appropriate that you are going to? It is just like a breaking bad news. At that time, you said nice to meet you. I think it wasn't appropriate.
Not appropriate, yes. After I say it, I feel that it's not appropriate.
Yes, yes, it happens. It happened in my case also. Okay, and or that and another thing that I was trying to say that you were saying rheumatology clinic. That rheumatology is a medical term, so you shouldn't say
Yes.
rheumatology.
Joint.
You can say the joint doctor
Yeah.
or a joint clinic. And another thing that you should have apologized before telling me the uh, bad news. I am extremely sorry that, or I apologize that there was a mistaken happening
Uh,
at place.
I did. I said.
I cannot exactly remember that, so I am just telling it. Okay, this was extraordinarily fine. Okay, and you have answered on my all my question that, and also whenever you told that this tissue was lost, and at the same time you have also ensured that it will not happen in the future. You will take care of it, and also for this case you have raised voice or you have raised concern to the respective department, so they will investigate this case. This was totally excellent.
When she mentioned that she doesn't want to do again, should I encourage her for resampling?
Yes, because another biopsy is needed. Otherwise, it was decided that she needs another biopsy. So at that time, you are good that you want to know that okay, lost. What I told you that what should I do or what will you do at this time? And at this time, you are told that another sample is needed to uh, do this because without this we cannot treat you properly. I know that this is condition. This will be a hard condition for you to do this test, but yeah, if you can share, is there any problem with that? So we'll be able to take care of that. Okay. Already she mentioned that she had pain. That was a good issue. And you have also explained that you will take care of this. Okay, this was fine. So can I go for the next case?
Yes.
Do you want to
Thank
add
you.
anything?
No.
Okay, I'm going for the next case. Okay.
No.
Okay, start.
Hello.
Hello.
This is Dr. Gabra, the doctor in the joint clinic. Are you Mrs. Selena, 35-year-old?
Yes, Doctor. I am.
Nice to meet you, mom. We are here today to discuss your condition and what we can do further. Is that okay with you?
Yes, Doctor.
So, how are you feeling now?
Doctor, I had this lupus disease for a long time, but recently it has become worse. I have developed my swollen legs, and also I have found problem in my water work. And this is very bad for me. And my GP is suspecting that I have problem with my kidney. I don't know that actually what did he mean, and what should I do now?
Mrs. Selena, I'm sorry for all you are suffering, and we are here today to help you and to guide your treatment further. Uh, your doctor review your condition, and as you said, he suspects an issue in your water work system. For that, you need a procedure called renal biopsy. It is a procedure where tissue from your kidney taken for analysis and to be studied, and the result it will be shown later. It guide your further management. Have you ever heard about this procedure?
No, doctor. Is it a operation just like kidney operation?
It is not like kidney. I appreciate your concern. It is a procedure in which there is expert in this field. They will do your procedure. They will have a small cut in your back, and they will insert sharp item after taking care of cleaning and reducing the pain, and they will take very small sample and piece from your kidney, and it will be sent for study.
Okay, doctor, I can understand. And is it painful?
Uh, the procedure itself, it's painful, but we will do our best to reduce your pain by giving medication either through your blood channel or topically in the area.
Okay, will I remain conscious, or I will be need to be unconscious during the procedure?
No, no, you will be fully conscious. It is minimal procedure, doesn't need general, doesn't need to be sleep. We will give you topical numbness item. You will not feel any pain during the procedure.
Okay, doctor, that sounds good. And does it have any side effect or any serious thing that can cause by it?
I appreciate your concern, Mrs. Selena. And unfortunately, every procedure have its own unwanted effects. It can cause pain, it can cause bleeding, it can cause infection, and or even damage of the internal organ. But
Can I die,
the
doctor,
best,
during this procedure?
it is a rare possibility, but it is possible, and we will reduce this chance that the best team who did this procedure many times with no complication, they will do your procedure, and it will be very minimal, and there's less chance for that.
Okay, doctor, I am actually getting afraid of that. Do not you have any other alternatives?
Mrs. Selena,
Community mining?
best way to treat your condition after we have the sample and we have the result, we will know very well how to treat you, and it will guide your future treatment. If we don't have this procedure and result, we will treat you blindly, and we cannot guarantee the improvement for your condition. And your condition is very serious and need this procedure to guide the treatment.
Can you just allow me some time to think of it?
For sure, it is fully your right to think about the procedure. We will give you more information about it. You will have time to think about, but I advise you to have this decision as soon as possible, because early treatment give better chance for improvement.
Time up. Okay, thank you, doctor.
Thank you.
Okay, so I am just this was totally fine, and you have made every concern of it. Just I needed to ask you twice that will I feel pain? Your first answer wasn't something straightforward. Okay,
First answer was
okay.
the
Actually,
side effect, you mean?
there might be some pain, but we will give you some numbing agent, and during giving the numbing agent, you will feel a very little pain, and after giving the numbing agent, there will be no pain. Okay, so you could have given answer in a short time, so I could have asked you more question. Okay, that one question I want to ask, that do I need to be admitted into the hospital?
Yes, sure. You will be admitted in the hospital for close observation, and you need follow up after procedure to monitor your blood pressure and general condition, and to watch any complication.
Okay. Do I need to take or stop any medication?
For sure, all your medication will be reviewed. If there is especially thinning medication, should be stopped ahead of time by good interval.
Okay, that is fine. And one thing that I cannot surely tell you that nice to meet you was appropriate this case also.
This not good here. Nice to meet you.
These cases, I think nice to meet should be avoided because this is a serious thing we are going to discuss. This was not just a
So better not to mention at all.
yes.
So,
I think that will be better because that will not bring any mark, even it can reduce mark. Okay.
you have two more questions. You mean it should be during my time, or is this extra?
Yes, I could have asked you during that time because whenever I asked you that do I have will I feel pain, you give a long answer for that. You will insert any detail that will cause pain. Actually, if you give
So the mark will be deducted, right?
if you have given a short answer and a specific answer, and at that time I will yeah, you could have covered all this question.
If I don't cover all questions, the
No,
mark will be deducted.
that doesn't mean that you don't know. That means that you're taking less time. You should be more technical because they will give all the questions and that you can cover within this time. So try to become more technical and more specific giving the answer. And, sometimes even not asked, try to some hide something that is in this case you have done it that until I ask that does it have any bad side effect, you haven't mentioned. And even if I haven't asked anything, then you could have introduced yourself that this procedure isn't straightforward, this also has some side effects, do you want to know this? Okay, even if I haven't asked you, I have asked and you have answered in a very good way.
I didn't mention because in the previous case, when the introducing medication, you asked me not to mention the side effect unless mentioned by the
So
surrogate.
in this case, you have done it well because the surrogate didn't wanted to know all the procedures because and within 6 minutes you will not be able to all the procedures that we are going to review medication. We will need to stop the medication. Some medication 1 week back. If you are taking some medication at the morning, that's not possible for us because we are not given so much information here. Here our task is to manage her for renal biopsy and what is necessary for renal biopsy that we are giving the procedure what is done this time. And there were some procedures, some questions, other questions, other extra questions that will it be done at a point, or will they need to do it frequently, and doing this test this time means that I will not to do this test again. Is it confirmatory? There was certain other a lot of questions. Okay, so that will be asked by the examiner if you cannot cover all those. So don't worry if you cannot cover those, just try to give more specific answer.
Uh, but can I ask something? Because uh, should I wait the question of surrogate to mention the side effect, the follow up, the admission? I should inform by myself, right?
If surrogate isn't asking you at once, then you can after the explaining the procedure, then you can ask that it is important to first you should say the good size, that it is important to know the stage of the kidney involvement, and so that we can give you the best and appropriate treatment. But this and after giving some pause, patient asks, okay, I can understand this is important, but does it have any side effect? Then you can ask. And if patient don't ask anything, then okay, but I can but this test isn't straightforward, this has also some side effects, do you want to know that? Okay, and giving pause will allow the surrogate to ask question.
Hmm.
Do you want to practice more or will you stop?
I'm willing. If you are willing, I'm.
Start.
Hello.
Hello.
This is Dr. Gabrao, one of the doctor in the joint clinic. Are you Mrs. Selina, 35 year
Yes,
old?
Dr. Yes.
So we are here today to discuss your current condition and what we can do further. Is that okay with you?
Yes, Doctor. I really want to know because recently my condition, you know that I have a condition called SLE, and this condition has worsened recently. And this is so unbearable for me, Doctor. And for this, my GP sent me here, and your clinic did a test, some taken some sample from my kidney, and they said that the test results should come soon. And I was called today to take this report, and I actually want to know that what is happening with me, Doctor.
So the sample result is with me now, but unfortunately the result not not as we hope.
What do you mean by as we hope, Doctor? Is it
Uh,
safe?
I'm I'm sorry, Mrs. Selina, but the sample result showed that the 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 condition you have is within the stage renal disease.
What do you mean by this, Doctor?
This means that uh, your disease, your renal disease, is in so advanced stage that cannot be improved by medical treatment and cannot be recovered.
What are you saying, Doctor? That means my kidney was totally damaged, and you cannot treat this condition. Am I going to die?
I'm so sorry, Mrs. Selina, but really your condition is serious and your kidney in very advanced stage, and no treatment can recover your kidney.
Well, Doctor, this is greatly shocking news. So that you
I'm
are
so
going.
sorry for the bad information that I'm transferring
Cannot be
to you.
there any wrong in the test, Doctor?
No, it is. I appreciate your concern, but the result is surely correct, and we confirm twice with your name and result test. And there is no chance that there is mistake in the result.
Cannot be there any problem with your doctors, with your collection that you have done the wrong. There might be some good on my other kidney.
And I appreciate your concern, Ms. Selina, but we are sure about the result of the sample and the disease that affecting your one kidney. It affect the both kidney in the same time, and it will show the same result.
Doctor, I cannot actually accept this. Cannot you do this test again on my other kidney?
I appreciate your concern, Ms. Selina, but this is invasive procedure. That means the procedure has so many unwanted effects. It can damage
Or
your.
whatever happens, yeah, well, I am going to die this way or that way. So you just do this test, and I just want to
Uh,
know that if even if there is any chance.
Yeah, I get you, Mrs. Selina, but doing the procedure again will not add any more information, and it will add another pain and another side effect to your body, and
Congratulations.
it doesn't give any more information.
So that means you cannot do anything for me.
yeah, Mrs. Selena will be followed up by our best team. They will give you all the treatment that reduce your symptom and control your suffering.
Will I live without kidney doctor?
Uh, it will You will be followed up by our kidney doctor. He will decide for you alternative treatment. Maybe you need uh, uh, replacement therapy to remove all the element in your that eliminated by your kidney. It will be
Time up.
eliminated by other method, which is renal replacement therapy.
Time up. Okay.
Yeah. Should I explain about renal replacement therapy? It's not mentioned in the task.
That one, just that you have explained everything well and in a very good way. Just one thing that you first you have frightened the patient that there is nothing can be done with your kidney. That no medication can treat her medically, but there is certain things that can be done. That is renal replacement therapy. Even there might be some consideration for renal transplant.
Because I was confused that there is no clear in the task that
Okay, okay.
the
Cannot
plan will.
renal condition cannot be treated medically. That doesn't mean that
Yeah,
we cannot treat her. We cannot treat her. That's
and
that her renal condition
medically
cannot.
doesn't include renal replacement therapy.
No,
There is medically.
and also it is given that end-stage renal disease, and at end-stage renal disease we can give her the replacement therapy.
Mm,
Okay.
yes. I should explain all the renal replacement
No, no, no.
therapy.
Just mentioning that. Okay, at this stage, it has involved this condition has involved your kidney, and we cannot reverse the condition. And also, it has involved so much that kidney is not working. I am sorry to say that. Okay, but we will try to give our best alternative management. We will talk to the kidney doctors, and they will be able to if they will be review your condition, and they will uh, give you the alternative management that is available.
Mhm.
Okay, that is you are showing some hope, but you have making me the patient totally frightened that you are going she's just going to die.
There
Just
is
that is
nothing
what
can be done. Yeah, because I was confused that medically I thought even the renal replacement therapy. But at later I explained that I refer to kidney doctor to give
yes,
alternative by renal replacement.
yes. So that I was just repeatedly was asking you that cannot you do anything,
Mm.
and all of the information are not given till now. Just biopsy report is given. Okay, and you are here to just tell about the biopsy report, and at the same time we do not know that if what was the decision of the kidney doctors, or what will be the decision of the kidney doctor. Patient is here only to know about her biopsy report.
Mm-mm.
So patient initially told that I want to know the biopsy report. So biopsy report, whatever shown the biopsy report, you are just telling that, and also at the same time you are telling that we are involving, and it is not given that kidney doctors or nephrologists have said that they cannot do anything, even renal replacement therapy. You will just keep an option. Okay, your test result shows this, and we will involve the kidney doctors and joint doctors, and they will be able to give you what is available with this. And also I told you that without my kidney, can I live, or will I die without my kidney? Okay, and it is intestinal disease. There are certain other treatment therapy that is called renal replacement therapy. We will review you for that. And with that, some people's late almost normal life. Okay, otherwise everything was fine.
Mm.
what and whatever opinion or whatever information isn't given, don't assume it, because sometimes assumption can bring some bad effects. Whatever isn't
uh,
given, just think that you don't know that. And here
uh,
your nephrologist opinion isn't given, so you don't know nephrologist opinion, so just keep that an option, that we can discuss this with the kidney doctor. And if the condition was given that patient is going to die, then you could say that okay, there cannot be done anything. And whatever isn't given, it is your opportunity, or that you can involve that, or you can take opinion from that. Here only the
uh,
biopsy report is given. Okay, this was totally fine. You have done very well.